While International Men's Day observed on November 20th was seen as a time to honor the achievements of men both locally and abroad, the occasion was also used to highlight some of the issues that continue to affect this gender. Locally, one of the major problems that was brought to the forefront during the observance was the struggles Guyanese men faced with their mental health. A staggering announcement by Minister Persaud at that time revealed that over the past 5 years, the suicide rate among men has been spiking, with some 605 men committing suicide between 2016 and 2021. Against this backdrop, the minister, in a recent interview with this newscast, revealed that the ministry intends on tackling this issue head-on.
We started the discussion just recently with the head of the psychology department at the Georgetown Public Hospital, and he has committed to working closely with this ministry through our men's and women's groups so that we can have a more aggressive approach to looking at these mental health issues.
As is the norm with statistics on social ills, it is hard to determine whether the figures available are a true representation of the problem. This is especially true in this instance since a significant percentage of mental health cases are undiagnosed.
And then also the whole gamut of mental health illnesses that sometimes are underdiagnosed, not diagnosed, and even the person is not aware of. And that sometimes maybe because of the stigma that exists when people hear about mental health, and primarily men might not see the need to say, well, there is something wrong, seek help.
It is believed that society's expectations and traditional gender roles play a part in why men are less likely to discuss or seek help for their mental health problems. Men are often expected to be the breadwinners and to be strong, dominant, and in control, and these factors can make it harder for men to reach out for help and talk about their issues. As such, the minister is hoping that through this collaboration, programs can be implemented to help men vocalize their feelings. In the meantime, the ministry continues to directly target men.
The Gender Affairs Bureau would have been going outwards into communities because I really wanted to have that community engagement. I think by now the country realizes that I see the value in directly engaging communities.
Additionally, through a series of community sensitization sessions, men have been receiving training aimed at effectively responding to the contributing factors of mental health illnesses.
Formed men groups, given them training, conflict resolution, anger management, coping mechanisms, and that one is a big one because usually it is dysfunctional coping mechanisms that would cause someone to give up.
For the HGP Nightly News, Kendell Richmond.